Housing insecurity has become a growing challenge for not only our members at Trillium, but also for the community. My name is Ray Bauman. I'm the Vice President of Medical Management with Trillium Community Health Plan. We have leveraged our bedrock partnership with Lane County, joining forces with Shelter Care to develop the FUSE program, a true housing first initiative.
A FUSE client is identified as being somebody who frequently utilizes emergency services in Lane County, who makes frequent ER visits, for instance, or is frequently arrested. If this is occurring, they will be added to the FUSE list that's updated and distributed to FUSE outreach workers and our community partners. We try to prioritize individuals with the highest vulnerability scores to work with them and get them into housing as quickly as possible for their safety. We work with community partners to identify individuals on the list, and we provide all the background support that they need to be successful. It's a lot of work.
Before I lived here, I was homeless. It was a lot harder out there. Got in a lot of trouble. Yeah, this is the first stability I've had in 10 years. Makes me feel good to be in here. It's a nice apartment. Trillium helps me a lot with the dentist, the doctor, because I can't really afford it if I didn't have Trillium.
FUSE outreach workers worked with Trillium case managers to set Jill up with appointments for a primary care physician so she could see a doctor. We always strive to connect our clients to services, so outpatient treatment, detox centers, behavioral health. It takes time, and of course it's always up to the client. But when that happens, that's when the Housing First model is working. The Housing First model essentially operates under the belief that housing is a human right. Everyone has a right to housing. If you're sleeping outside and you don't have an address, it's very difficult to establish a PCP and keep your appointments. So once clients have a place to stay, they were able to set up those appointments, and they didn't have to resort to going to the ER when they needed medical attention. It was dramatic and observable firsthand working with the clients. They just needed somewhere to stay.
Without Shelter Care and Trillium, I'd be out there on the streets homeless again.
Without Trillium and without Shelter Care, I'd be out on the streets too. When you're sleeping out there homeless, you never know.
You don't know from one day to the next what's going to be like.
I like living here. Yeah, keeps me out of trouble.
I think the longer the FUSE program continues, the more people are going to be helped. It's a really tough housing market out there, and a lot of our clients who have stabilized and taken steps to turn their lives around have great difficulty getting into housing.
Yeah, this is my permanent home now, finally.
Jill and Henry are going to be great. Jill loves her new place. She's engaging in more services than before. She's going out into the community. She's connecting. She's stabilizing, and she's doing great work. And she will continue to receive support from her case manager. And she will continue to see Henry. They hang out a lot, have a lot of fun together.